what I learned from that is that when you have knowledge, you have a choice. And then when you know different, you can make different choices. And I've sort of incorporated that in my family, in my life, and with clients.
Welcome back to the Organically Uncut Podcast. Organically being we are in the salon, and you may hear a few noises every now and then or have one of the apprentices come through. But welcome back, and today we're talking about something that affects all of us, and that is the food that we eat and how it fuels our bodies and our mind. So our guest today is Janis Sennett, and Janis is actually a client of mine, but this woman is a powerhouse of knowledge. She is hungry for knowledge and is educating herself every appointment. She's doing something new. She's extremely inspiring. So Janis is actually a clinical nutritionist and a certified metabolic balance practitioner. So for those who don't know what they are, could you first walk me through and explain what is a clinical nutritionist, Janis?
Okay. Clinical nutritionist is someone who can work with clients with presenting symptoms, some illnesses, some conditions, and what we do is we work with the client. It's client driven, and it's based on food and lifestyle. So, and then sometimes we also need to have a little bit of extra help, which is we have practitioner-only nutraceuticals that are specially formulated and can be prescribed by us that will also assist and support clients to further their wellness.
That's great. So a metabolic balance practitioner and the clinical nutritionist go hand in hand, or are they quite different?
Actually, they go hand in hand.
Okay.
Because a metabolic balance practitioner has the science from bloods, values, 36 parameters. I actually do 2 more. And we also take into account your foods that you currently eat and what you don't like, some of your medical history, and by having all that information, I can then use that. I send it off to a company called Metabolic Balance.
Yes.
And then it generates a plan for the client that is specifically designed for their metabolism.
Okay.
So it works off of your nutrient deficiencies. It works off of, so your bloods that get assessed is a metabolic assessment of liver, kidney, red blood cell count, bone calcium, actually, and then there's what else? A couple of others, but
that's okay.
But basically, what it does is it gives an overall picture of how your body is functioning.
Okay, and then you use all that information long term with a client. Like once they do this, is this a long term, lifelong commitment, or is it a short term thing?
Okay,
how does that work?
Yeah, initially it's a short-term reset, 3 months, 12-week program for long-term. So what you do is you are resetting your metabolism, you are learning about food, you're learning how your body works, and you're actually just recalibrating how your body works more efficiently.
Okay, and when would someone reach out to you or look for a clinical nutritionist or metabolic reset?
So it's when I think you can have certain life things happen in your life and you start feeling a little bit lower and you have energy, you get fatigued, midlife, and like you start seeing, I've got weight a little bit in different places, and you're not functioning like you used to. Like we all get old, but is there a way to sustain that more effectively? So that's why I did the metabolic balance, because I was like, something's not right here. So I actually did the program myself because I wanted to understand it so I could explain it. And through doing that, I actually restored my own energy. I sleep better, my weight shifted, and I've just noticed an overall vitality that I didn't have. I also noticed that my liver enzymes, because even though I am a healthy person, as you get older, your markers start to fluctuate a little bit.
In your liver.
Yeah, my liver
Marks in
function
your
was a
liver.
little bit hazy, but now that's all come like settled. And then my cholesterol, like it does go up a little bit naturally as we get age, but it's also like that can sometimes be lowered. Blood pressure can be lowered.
Wow.
With food,
Yes.
like, and other things.
Yes.
But yeah.
So you work with obviously Western medicines as well as you know, natural nutritional things, vitamins, minerals, and whatever. Can the two work together? Like, okay,
definitely.
So you do that. So if people are on medication, they can do it. They don't have to come off of everything. Like,
there are a few limiting things with the metabolic balance. Yes, you can. We do take into consideration medications, but with working with Western medicine, if someone comes to me and they have a GP plan in place, my role is to support that plan because it is diagnosed. I don't diagnose.
okay.
Clinical nutritionists do not diagnose. We support, we investigate, and then we refer on because that's our scope.
Okay, that's great. That makes it really clear. So doing a bit of a deep dive into the metabolic balance, because you've done it yourself. So that's why you sort of added this to your long list, very long list of qualifications. Because you've done it yourself, is that where it started for you, this journey?
No.
Okay. Can you share with us a bit
My
about
health journey, I've always been a curious kid.
Yes.
So when I was a teenager, I came across this big book and it was called Foods That Harm, Foods That Heal. And I
have that book.
Yes?
Yeah.
Yeah. It was my nana's book.
Okay.
Yeah. So I was just like, wow, what is this? Like, I was just like, this is powerful stuff. Like, food is medicine, it's readily available. And I've always had it rattle around in my head, food is medicine. So then I was like thinking, okay, I also have family history, I also have medical history, and I've got cancer, I've also got metabolic syndrome, and there's metabolism not so good with some of my family. So I was like, how can this food support my family? And then I was like, I just kept going down this path, and then in 2013 I had to break up with dairy because I became lactose intolerant. And then I also became gluten sensitive, and I'm just like, okay, what's the mechanism? Why? I'm not broken, I just don't function like I used to.
I love that.
So I was like, how can I support myself? So then I began to look into what can I do? What's the science? What's the mechanisms? And I could only get a certain amount of information on the internet because this is like, it's in depth. It's full on, actually. So I went, I might go do a bachelor's degree in
Why not?
Bachelor of
In all
Science.
your spare time.
Yeah, exactly. Nutrition and dietetic medicine. Why not? Like, I was like, I can do this. Anyway, 3.5 years later, I did do it, and I was very proud of myself. And what I learnt from that is that when you have knowledge, you have a choice. And then when you know different, you can make different choices. And I've sort of incorporated that in my family, in my life, and with clients.
Do you call them clients, patients? Because I'm not sure what to refer to them as.
Do you know, each to their own? Like my clinic, your clients.
Yes. Yeah.
I feel, for me personally, a patient is a hospital. But I like to be a client because you're coming to me, you're working with me, and I feel like a patient, it's more of a illness word. And I would like, and I'm very strong on words. Yeah.
You are.
Yeah.
Yes.
Yeah.
Yes, the power words and the words, the power of your words and shaping your world, and yes, very much so. So can you walk us through like a personalised sort of plan for how you would start with somebody?
For metabolic balance? Yeah, sure. So what happens is if you're interested, you book a discovery call. It's free. It's 15 minutes, and we just sort of get to know each other. And you have any questions, I answer them. Then, if you fit the requirements, because there are a few little tick the boxes, you have to be willing to eat fruit and vegetable.
Okay.
Like, it's food. Food is the core. If you're pregnant, breastfeeding, if you are underweight in your BMI, it's not suitable.
Okay. Yes.
Because it will possibly be weight management.
Okay.
Yeah. Another thing is, after we've talked about that, it's then you book in and then you do the program with me, 12 weeks minimum. And you do your blood work, we do a in-depth intake form, you give me some weight measurements, and you've got your gender, age, and then I send that off to Metabolic Balance, and then they send me back a plan, and that is personalised, targeted nutrition on a metabolic level.
For where that person's at
Yes.
that time.
Yeah, because it takes into account any illness, medical conditions you have, any medication you're on, any foods you dislike, because I'm going to be honest, camel milk does come back.
Wow.
Because in the database is every single food and its nutrition value.
Wow.
So from your blood work that comes back, it then assesses where are you nutrient deficient, what markers are needing support, and then it comes back.
Right.
And it's really surprising what food came back.
Wow.
Yeah.
That's a real deep dive, isn't it?
It is.
Yeah.
It is.
Into finding out what's going on.
Yeah.
The uniqueness of everybody's, I suppose, individual design.
Yes.
And as that changes through their life.
Yep.
Because, you do naturally look back and go, I don't feel how I used to, or why could I eat that but now I can't, which is what you've experienced yourself. Do you have a lot of clients that find they're frustrated and come to you, they can't shift weight, they can't sleep properly, gut issues? Are these the things you find, or is there something?
Or those symptoms are up there.
Okay.
And I think the more exposure we have to life, you've got stresses, you've got more commitments. If you're a family, you've got family commitments, and you've got different priorities, and if you haven't got the energy, if you're not sleeping right, if you're not putting the right food in, then you're not going to be able to reset and digest to then look after your parasympathetic system, which is what modulates your nervous system.
Okay. So the nutrition, the food, and the rest and the sleep are a big part of what you're doing.
Yeah. And the more I discover about sleep, the more I wish I slept more.
Wow. Okay.
Yeah.
That sounds like another session to talk about that one. I would love to do a session on that.
Mind blowing.
Yeah.
Yes.
That would be great. So for the listeners, how would they know when they shouldn't choose you? What type of person wouldn't choose to come and see you? What would you suggest?
Someone who's contemplating, like not ready to commit. I feel that your wellness journey, when you're ready to shift, you'll find your person. If you're not ready, don't waste your money. Like, honestly.
Love that.
It's
transparency.
Yeah. And I'm big. I will be honest, like, I'm not for everybody. I really am not. And that's fine, because there's some people who are for you.
Yes.
Yeah.
Yes.
I'm very science evidence based. I don't do fats.
Yes.
They're not sustainable.
What's a myth that you'd love to bust around this?
Well, I guess my biggest one that's cops a lot is carbs.
Right.
Yeah, carbs. Not all carbs are the same carbs. So carbs, if you're fruit, vegetables, whole grains, that's great if you can have gluten. But if it's the sugary snacks and the white bread that you just maybe don't have, but carbs they fuel us. They are our energy source. Yeah. So
Yeah.
I love carbs. I love fruit and vegetables.
Because there is a lot of talk at the moment around very protein heavy diets and, you know, the carnivore movement. And we've got a lot of clients that have had great success with it. And we won't dive too deeply into it today, but is there a space where that works, where that protein heavy diet is good for people?
Good question. I think I don't know enough about it, to be honest. I think that protein is important, but at a weight that your body can assimilate it. So it could work for some people great, and that's wonderful, but it might not work for another person because your history, your bio-individuality works very differently. I know that someone who's a vegetarian, if they introduce protein like carnivore straight into their body, would probably not
doesn't
work
handle it because it's the gut biome isn't designed it's kind of being starved or whatever, or
I think it's just a shock. I
You're
think
right.
it'd be a body shock.
Yeah.
I also feel that when you like diversity, like you want to be exposing your body to different types of proteins and different types of carbs and different type of fats, healthy fats. I'm not a huge advocate for
like removing things all
monotone,
together. Right.
Unless
monotone, I like that.
like monotone, like just specific. It's great if it works, like that's fantastic. But for myself personally,
What's one thing that you would love to share with everybody that maybe we haven't covered? Because there's a lot to cover.
Oh my giddy aunts. I think something is that it's your wellness journey. So specifically work with what aligns with you. If you're looking at information, is it real, verifiable, science-based? Is it sustainable? I think that the more you explore, the more you learn, and the more that you can like then build on that.
I agree, definitely. So we want to thank you obviously for coming in today and being with us, but is there somewhere where people can find you that we can kind of lead them to? We will have notes in the bottom of the show notes,
for sure. I've got a website. It's janissennett.com. I'm also on Facebook and I'm on Instagram.
Amazing. And we will attach all of that at the bottom. And it's been amazing having you in today. I could talk to you, as we do at your appointments, for hours about your knowledge on things. But would you be keen to come back and have another session with us?
I'd love to.
Yeah, I think we should talk about sleep next, because that's something that a lot of people struggle with. So I just want to say thank you. And thanks very much for being with us. And thanks everybody for joining us today. Love to love you. Bye.
Thank you.